The most dangerous thing about cancer is not always the pain. Sometimes it is the silence. A person can wake up, go to work, eat normally, laugh with family, and sleep peacefully at night, while abnormal cells are growing quietly inside the body. No sharp pain, no obvious lump, no dramatic warning, no clear sign that something serious has already started. And that is what makes cancer so frightening, because many people believe the body will always warn them immediately when something is wrong. But cancer does not always work that way. Sometimes, by the time symptoms finally appear, the disease may have already been developing quietly for months, or even years. But how is that possible? How can something dangerous grow inside the body without causing pain? How can the immune system miss it? And why do some cancers stay hidden until they become harder to treat? To understand that, we need to go deep inside the body, not to the organ, not to the tumor, but to where cancer truly begins, inside a single cell. Cancer does not usually begin as a large tumor. It does not usually begin as sudden pain. And it does not usually begin as something a person can feel with their hand. In many cases, cancer begins with one damaged cell, just one. The human body is made of trillions of cells. These cells are constantly working, dividing, repairing, replacing, and dying. Your skin cells renew. Your blood cells are replaced. Your digestive lining repairs itself. Your body is always rebuilding itself quietly in the background. Normally, this process is highly controlled. A healthy cell knows when to grow. It knows when to divide. It knows when to stop. And when it becomes old or damaged, it is supposed to die. So a healthier cell can take its place. But cancer begins when this control system breaks. The DNA inside a cell becomes damaged or changed. DNA is like the instruction manual of the cell. It tells the cell what to do, how to behave, when to divide, and when to stop dividing. But when that instruction manual becomes corrupted, the cell may stop obeying the normal rules. Instead of stopping, it keeps growing. Instead of dying, it survives. Instead of staying controlled, it begins to multiply. One abnormal cell becomes two become four become 8, and slowly, a small group of abnormal cells begins to form. At this stage, the body may not feel anything at all. There may be no pain because nothing is being pressed. There may be no bleeding because no blood vessel has been damaged. There may be no swelling because the growth is still too small. There may be no tiredness, no cough, no weight loss, no digestive problem. The person may feel completely normal. And that is one of the first reasons cancer can grow silently. It starts at a level too small for the body to notice. But here is where it gets more serious. If that abnormal cell keeps dividing, the body now has a second problem. Not just one damaged cell, but a growing group of cells that no longer obey normal rules. And once cells stop obeying the rules, the silence can become dangerous. Now you may wonder, if the body is so advanced, why does it not destroy cancer immediately? The truth is, the body does try. Every day, your body deals with damaged cells. Your immune system is constantly looking for threats. Your repair systems fix DNA damage. Your body removes cells that are no longer safe. In many cases, dangerous changes are corrected before they ever become a problem. But cancer is complicated. Some abnormal cells do not look dangerous at first. Some grow slowly. Some avoid immune detection. Some produce signals that help them survive. Some hide among normal cells. And some are simply too small in the beginning to cause a strong alarm. Think of it like a thief hiding in a large city. If the thief is loud, destructive, and obvious, people notice quickly. But if the thief looks normal, moves quietly, and blends into the crowd, it may take much longer to detect. Cancer cells can sometimes behave like that. They are not foreign invaders like bacteria or viruses. They come from the body's own cells. That makes them harder for the immune system to recognize. They may carry enough self-signals to avoid immediate attack. So instead of being destroyed early, they can quietly continue dividing. This is why cancer is not just a disease of growth. It is also a disease of escape. Cancer cells escape normal control. They escape normal death signals. They may escape immune detection, and eventually, they may escape the place where they first started. But before that happens, They often pass through a quiet stage, a stage where the cancer is growing, but the person still feels fine. And this is where many people misunderstand cancer. They think, if something serious was happening, I would know. But the body does not always warn you at the beginning. Sometimes, it only warns you when the damage becomes large enough to interfere with normal function. And by then, the situation may already be more serious. Pain is one of the body's warning systems. But pain does not happen simply because something is dangerous. Pain usually happens when nerves are irritated, stretched, compressed, inflamed, or damaged. So a tumor can grow silently if it is not touching nerves or interfering with sensitive structures. That is why the location of cancer matters so much. A small tumor in one part of the body may cause symptoms early, but another tumor of the same size, in a different location, may cause nothing. Some organs have more space around them. Some areas have fewer pain-sensitive nerves. Some tumors grow slowly enough that the body adapts for a while, and some cancers grow deep inside the body where they cannot be seen or felt. For example, a tumor inside the colon may grow for some time before it causes bleeding, blockage, or a clear change in bowel habits. A tumor in the lung may grow before it causes breathing problems, especially if it is not blocking an airway. A tumor in the pancreas may stay hidden because the pancreas sits deep inside the abdomen. A tumor in the liver may not cause early pain because the liver can keep functioning even when part of it is affected. This is why cancer symptoms depend on three things: where the cancer is growing, how large it has become, and what body function it has started to disturb. Cancer does not cause symptoms just because it exists. It causes symptoms when it begins to affect something the body depends on. And this is one of the most important lessons in the entire video. The absence of pain does not always mean the absence of disease, and the presence of pain does not always mean cancer. But when cancer grows silently, it is often because it has not yet crossed the line, where the body is forced to react. That line may be pressure, it may be bleeding, it may be blockage, it may be inflammation, it may be organ dysfunction, it may be spread. And once cancer crosses that line, symptoms may finally appear. But by then, the cancer may no longer be in its earliest stage. Before going deeper, there is something important we need to clear up. A tumor and cancer are not always the same thing. A tumor is an abnormal mass or growth, but not every tumor is cancer. Some tumors are benign. Benign tumors can grow, but they usually do not invade nearby tissues or spread to distant parts of the body. Cancerous tumors are different. They can invade nearby tissue. They can damage normal structures, and some cancer cells can break away and travel through the blood or lymph system to other parts of the body. That spreading process is called metastasis, and this is one reason cancer can become life-threatening. The original tumor may be only part of the problem. The greater danger is when cancer cells gain the ability to move, survive, and grow somewhere else. But here is the disturbing part. The process leading up to this can begin quietly. A tumor can be growing before it is felt. Cancer cells can be changing before symptoms appear. The body may still be functioning well enough that the person feels normal. And this creates a dangerous delay because many people wait until symptoms become impossible to ignore. But cancer does not always wait. It can keep growing while the person is still trying to explain away small changes. One reason cancer is often detected late is not because people are careless. It is because early symptoms can look ordinary. Tiredness can feel like stress. Weight loss can look like a change in appetite. Bloating can be blamed on food. A cough can be blamed on weather, allergies, or a cold. Blood in stool can be blamed on piles or irritation. Pain can be blamed on age, posture, or work. A lump can be ignored if it does not hurt. Skin changes can be dismissed as dryness or irritation. And this is where cancer becomes psychologically dangerous, not only because of what it does to the body, but because of how easily the human mind explains symptoms away. People tell themselves, "I'm just tired. It will go away. It is probably nothing. I do not have time to check it. I feel okay most of the time. I will wait and see." And sometimes, yes, symptoms are caused by something minor. Most symptoms do not mean cancer, but the warning sign is persistence. a symptom that does not go away, a change that keeps coming back, a problem that slowly gets worse, a new body change with no clear explanation. That is when the body may be trying to move from whispering to shouting. But again, these signs do not automatically mean cancer. The point is not to panic. The point is to pay attention. Because the mistake is not having symptoms. The mistake is ignoring symptoms that continue. Symptoms usually appear when cancer begins to interfere with normal body function. This can happen in different ways. First, cancer can press on nearby tissues. If a tumor grows near nerves, it may cause pain. If it grows near an airway, it may affect breathing. If it grows near the bowel, it may affect digestion. If it grows near a blood vessel, it may affect circulation. Second, cancer can cause bleeding. Some tumors grow fragile blood vessels. Some invade tissues that bleed easily. Some cause bleeding that is visible. Others cause slow internal blood loss that may only show up as anemia or extreme tiredness. Third, cancer can block normal pathways. A tumor can block part of the colon. It can block bile flow. It can block urine flow. It can block air movement in the lungs. It can block fluid drainage. Fourth, cancer can change the body's energy balance. Some cancers use large amounts of energy. Some trigger inflammation. Some release substances that affect appetite and metabolism. This may lead to unexplained weight loss, weakness, or fatigue. Fifth, cancer can affect hormones. Certain tumors can produce hormones or interfere with hormone-producing organs. This can cause strange body changes that do not seem connected at first. And sixth, cancer can spread. When cancer spreads to another part of the body, symptoms may appear in places far away from where the cancer started. For example, a cancer that begins in one organ may later cause bone pain, breathing problems, neurological symptoms, or swelling, depending on where it spreads. This is why cancer can be confusing. The first symptom may not clearly point to the original source, and that is why proper medical evaluation matters, because the body may show the effect, but doctors have to find the cause. This is exactly why screening exists. Screening means checking for cancer before symptoms appear. That sentence is extremely important. Screening is not only for people who feel sick. In fact, screening is often designed for people who feel completely normal, because the goal is to find cancer or precancerous changes before they cause serious symptoms. This is why doctors recommend different screening tests based on age, risk, family history, and personal health. A colonoscopy can find abnormal growths in the colon, sometimes before they become cancer. A mammogram can detect breast changes before a lump is felt. A Pap test, or HPV test, can find cervical changes before cancer develops. A low-dose CT scan may help detect lung cancer early in certain people at higher risk. This is one of the strongest weapons against silent cancer, because screening does not wait for pain. It looks before pain begins. It looks before bleeding becomes obvious. It looks before the tumor grows large enough to be felt. It looks while the disease may still be in a more treatable stage. That is why early detection can change the outcome. But there is an important truth. There is no routine screening test for every type of cancer. Screening is powerful, but it is not perfect. Some cancers are still difficult to find early, and that is why body awareness still matters. Cancer does not always shout at the beginning. Sometimes the body whispers. A small change in bowel habits, a cough that does not go away, a sore that refuses to heal, unexplained weight loss, blood where blood should not be, a lump that remains, fatigue that feels different from normal tiredness, a change in the skin, unusual pain that continues, a change in appetite or swallowing. Again, these symptoms do not automatically mean cancer. Many non-cancer conditions can cause the same things, but the key word is persistent. If a change appears once and disappears, it may not be serious, but if it continues, returns, or gets worse, it deserves attention. The body is not always loud. Sometimes it gives small signals first, and the earlier those signals are checked, the better. This is where awareness becomes powerful. Awareness is not fear. Awareness is knowing when something is unusual enough to check. Fear makes people avoid the doctor. Awareness helps people take action early. And when it comes to cancer, timing can matter more than people realize. One of the most dangerous beliefs is, I feel fine, so nothing is wrong. Most of the time, feeling fine is a good sign, but it is not a perfect medical test. The body has reserves. Many organs can keep working, even when part of them is under stress. The liver can lose some function before symptoms become obvious. The lungs can compensate for changes for some time. The digestive system can keep moving, even when something is slowly developing. The body is built to survive. It adapts, it compensates, it hides problems until it can no longer hide them. That is helpful in daily life, but dangerous with silent disease. Because a person may not feel sick until the body's backup systems are overwhelmed. This is why some people are shocked after diagnosis. They say, but I was still working. I was still exercising. I had no pain. I thought it was just stress. I only noticed one small change. Cancer does not always make a person look sick in the beginning. Sometimes, the outside looks normal, while the inside is changing quietly. And that is why early testing and medical evaluation matter. Not because every symptom is cancer, but because silent growth is possible. Cancer becomes harder to treat when it spreads or affects vital organs. In the early stage, cancer may still be limited to one area. That means doctors may have more treatment options. Surgery may be more effective. Treatment may be less complicated. The cancer may not have spread. But when cancer spreads, treatment becomes more complex. Now, the issue may not be one tumor. It may be cancer cells in multiple locations. This is why metastasis is so serious. Cancer cells can break away from the original tumor, travel through blood or lymph vessels, survive in a new environment, and begin growing again. That process is not simple. Many cancer cells die during the journey, but the ones that survive can become dangerous. They may settle in organs like the liver, lungs, bones, or brain, depending on the cancer type. This is one reason doctors care so much about staging. The stage of cancer describes how far it has grown or spread. A lower stage often means the cancer is more localized. A higher stage may mean it has spread further. And in many cancers, earlier detection gives more treatment options. That is why the message of this video is not just watch for symptoms. The deeper message is, do not wait for symptoms to become severe before taking your body seriously. Because the earlier a problem is found, the more options there may be. Some cancers are often described as silent because they may not cause obvious symptoms early. This can happen for different reasons. The organ may be deep inside the body. The early tumor may be small. The symptoms may be vague. The body may compensate. The cancer may grow in a place with fewer pain-sensitive nerves, or the symptoms may resemble common everyday problems. For example, fatigue is common. Digestive changes are common. Back pain is common. Weight changes are common. Coughing is common. That is why silent cancers can be so difficult. Not because there are never signs, but because the signs may not look serious at first. They may look ordinary, and ordinary symptoms are easy to ignore. This is why the pattern matters. How long has it been happening? Is it getting worse? Is it unusual for you? Is it happening without a clear reason? Is it affecting your normal life? Is it returning again and again? These questions matter because cancer warning signs are often not about one dramatic moment. They are about changes that persist. Another reason some people need to be more careful is risk. Cancer can happen to anyone, but risk is not the same for everyone. Some people have a higher risk because of age, some because of smoking history, some because of family history, some because of inherited genetic changes, some because of long-term exposure to certain substances, some because of infections linked to cancer, some because of lifestyle factors, like heavy alcohol use, excess body weight, or long-term inactivity. Risk does not mean a person will definitely get cancer, and low risk does not mean a person can never get cancer. But risk helps doctors decide when screening should begin, which tests may be needed, and how closely someone should be monitored. This is why it is important to know family history. If multiple close relatives had certain cancers, Or if cancer happened at a young age in the family, doctors may recommend earlier screening or genetic counseling. This is also why two people may receive different medical advice. One person may need routine screening at a standard age. Another person may need earlier or more frequent testing because of risk factors. So the question is not only, do I feel sick? The better question is, what is my personal risk and what screening is recommended for someone like me? That question can save time. And sometimes, time is everything. There are two dangerous extremes. The first extreme is ignoring everything. This is when a person notices symptoms, but keeps delaying. They wait weeks, then months. They hope it disappears. They search online, but never speak to a professional. That can be dangerous, but the second extreme is also harmful. Panic. Some people hear about cancer and begin to fear every small body sensation. A headache becomes brain cancer. Tiredness becomes leukemia. Stomach discomfort becomes colon cancer. That is not healthy either. The goal is not panic. The goal is wisdom. Most symptoms are not cancer, but persistent, unusual, unexplained, or worsening symptoms should be checked. That is the balanced message. Do not ignore your body, but do not live in fear of your body. Pay attention, track changes, know your risk, follow screening guidelines, and speak to a qualified medical professional when something does not feel right. That is the safe and useful approach. Cancer can grow silently. Because early cancer may be too small to disturb the body, it can grow silently. Because the immune system may not recognize it immediately, it can grow silently. Because some tumors do not press on nerves at first, it can grow silently. Because organs can keep functioning for a while, even under stress, it can grow silently. Because early symptoms can look like normal life problems, and it can grow silently. Because many people wait for pain before they take action. But pain is not the only warning sign. Sometimes, the warning is a change that stays, a change that returns, a change that gets worse, a change that feels unusual for your body. Cancer does not always begin with a scream. Sometimes, it begins with silence, then a whisper, then a warning, and the goal is to listen before the body is forced to shout. So the next time you hear someone say, "I feel fine, so I do not need to check anything," remember this. Feeling fine is important, but it does not replace screening. Pain is important, but it is not the only sign of disease. Symptoms are important, but some cancers can begin before symptoms appear. That is why early detection matters. That is why screening matters. That is why persistent changes should not be ignored. Not because every change is cancer, but because the earlier a serious problem is found, the better the chance of doing something about it. Cancer can grow silently, but awareness can break that silence. If this video helped you understand what may happen inside the body before cancer symptoms appear, subscribe for more simple medical animations that explain the human body in a clear and visual way. And remember, this video is for education only. It is not medical advice. If you notice a persistent or unusual change in your body, speak with a qualified medical professional.